Assalamu alaikum. The topic that we are going to discuss is a maternal malnutrition. So, what is a malnutrition and what are the consequences of the malnutrition? And being a dietitian and being a nutritionist, how we can overcome these consequences and the complications that can be occur as a result of the malnutrition. So first of all, we need to understand what is a malnutrition. Malnutrition, basically, it is a global issue because it affecting the global population at the different stage of the life. Like it affects the pregnant women, it affects the lactating mothers and the children who have the age under the 5 and those who have the weak immune system because they are susceptible to the infections or the diseases. So, malnutrition basically involves the imbalance of the nutrient intake. Either you are taking in excessive amount or either you are taking in deficient amount. So, it involves both the undernutrition as well as the overnutrition. What is the undernutrition? Undernutrition, it involves the stunting and the wasting. What is the stunting? Stunting means a child has less height according to his age, and the wasting means low weight for the age. And the overnutrition is excessive accumulation of the fat, like the overweight, obesity, and the other chronic diseases like the cancer and the diabetes, non-communicable diseases. So, what is the situation of the malnutrition in Pakistan? Unfortunately, Pakistan is suffering from triple burden of the malnutrition. So, what is the triple burden? It means it is the triple burden of malnutrition, basically coexistence of the undernutrition and the overnutrition as well as the micronutrient deficiency. So, if we see the latest National Nutrition Survey, that is the 2018, there is no improvement was seen in the term of the maternal and the childhood nutrition. So basically, adequate nutrition is important for the health of the reproductive age women as well as for the pregnant women. So it's a scenario that you can see that it's a comparison of 1965 to 2018. What is the nutritional trends in Pakistan for the pregnant women and the children under the age of the 5? So these different color indicates the child stunting, wasting as well as the maternal anemia. So you can see that in 1965, approximately 10% children were suffering from the wasting, and in 2018, the percentage is 10 to 11%, and it is approximately 19% in the year of the 2018. So there is no improvement was seen in terms of the child wasting. So when we compare the child stunting, it was approximately 49% in 1965. In 2018, the child stunting was improved 6 to 7%. And maternal anemia, you can see that in 1965 and compare it to 2018, there was no improvement was seen in case of the maternal anemia. A little improvement was seen in the child stunting according to the National Nutrition Survey 2018. So, it is a scenario about the micronutrient deficiencies in the children under the age of 5. According to the National Nutrition Survey 2018, 62% children were suffering from the vitamin D deficiency, and we all know that vitamin D is very important micronutrient because it plays important role in the metabolism of the calcium. And 53% children were anemic and 28% were suffering from the iron deficiency anemia, and 18% were suffering from zinc. And the zinc is very important micronutrient because it boosts up our immune system. So 18% children who are suffering from the zinc deficiency, and the women of the reproductive age, according to the 2018 survey, 79% women were vitamin D deficient. So it means there is a more women are at the risk of the bone diseases like the osteoporosis, osteomalacia, and vitamin A deficiency 27%. and iron deficiency. Iron is very important for the reproductive age women and for the pregnant women, and 18% women were suffering from the iron deficiency. And the deficiency of iron affect the children IQ level, mental abilities, and the productivity capacity. So, how we can define the maternal nutrition? Basically, the nutrition of the fetus begin at the time of the conception, but the nutrition of the mother started before the conception, during the reproductive age, and during the pregnancy, as well as after the pregnancy. It is important. So, we should focus on the nutrient in all these stages. This is a WHO model for the malnutrition. There are the different causes of the malnutrition. There are the basic causes, there are the underlying causes, and there are the immediate causes. So, basic causes, like when there is a lack of the education, lack of the technology, lack of the resources, and political issues, automatically they will contribute the poor healthcare system in a community, in a country, in a society, and it will lead toward the household food insecurity, lack of access of food to the population, and automatically it will lead toward the poor feeding practices. And when all these factors will combine, they may contribute to the diseases. And inadequate diet intake due to the lack of the availability of the food, and all these factors may cause the maternal and child malnutrition. So maternal and child malnutrition has two types of the consequences. The some consequences are the short-term consequences, and the some consequences are the long-term consequences. Short-term, it may cause the mortality, disability, and the morbidity, but the long-term, it will affect the performance, cognitive abilities, stunting, metabolic diseases, and it will lead toward the intergenerational consequences. So, what are the intergenerational consequences? The consequences that can be transferred from one generation to another generation, because the nutrition of the mother is very important. It decides the destiny of the offspring. It affects across the lifespan. So there is no alternative of maternal nutrition. So you can see that if a mother is suffering from the malnutrition, so the malnutrition will affect at the time of the conception molecular level. So the cells may be the weak as a result of the malnutrition, maternal malnutrition. And the tissue that will become from these cells, they are also the weak, and the organs will also have some problems, and the human body that will form as a result of the malnutrition will be affected. All the problems that may be occur at the time of the molecular level. So the offspring that will be from this parent will automatically have the effect of these malnutrition, and it affects across the lifespan, because there is no alternative of the nutrition that a fetus gets at the time of the conception. So mostly in the developing countries, a woman has no access to the proper dietary intake, the proper vaccination, as well as the micronutrient supplementation. So the child that born from this mother may have the different diseases, like it may be the chronic diseases at the later stages of the life, and maybe suffer from the micronutrient deficiency. So there are the different causes. There may be the poverty in the developing countries. Poverty means there is the food insecurity, poor dietary habits, lack of education, and the lack of resources. So as we divided the maternal nutrition into three steps, before the conception, during the pregnancy, and after the pregnancy. So what is the preconception and care? The preconception care, the care that a female gets before the conception, and it started at the time of the adolescence. So we should focus on all the macronutrients as well as all the micronutrients. We should provide the education to the mothers, and there should be the women empowerment. That is the important goal of the sustainable development goals, millennium development goals. So preconception care started in the adolescence, and it is also important during the pregnancy. So many women enter pregnancy with depleted nutrition. They may suffer from, like we discussed in the National Nutrition Survey 2018, vitamin D deficient, iron deficient, calcium deficient, zinc deficient. So automatically it will affect the health of the fetus. A woman is underweight, it will also affect the health of the fetus. So there should be a guideline that a female should have the BMI according to the healthy range. As we all know that folic acid is very important, but a number of women have no knowledge regarding the importance of the folic acid before the conception and during the conception, and it may lead to the different birth defects. So pregnancy, it is a very important period because approximately half of the children under the age of 5 are the stunted. They have the low height according to their age, and stunting, it is a reflection of the chronic malnutrition. So when a woman entered in the pregnancy, anthropometric or the nutrition assessment is very important, and there are the different steps of the nutrition assessment. The first one is anthropometry, biochemical, clinical, as well as the dietary habits. So if a woman is suffering from the malnutrition, the fetus that is born from this mother, it may have the different problems across the lifespan, like the child may have the stunting and impaired brain development, lower IQ level, weak immune system, and the metabolic disorders and the chronic diseases, cancer, CVD, hypertension, diabetes throughout the life, because it affects across the lifespan of a child. So now, what is the reason of these micronutrient deficiencies? A number of programs are working to overcome the malnutrition in Pakistan. So, what is the reason? What are the causes? And being a nutritionist, what type of role we can play to overcome this problem in our country? So, basically, being a Pakistan is a food surplus country because it imports 3 to 4 million ton of the rice in the fall year 2018, 3 to 4 million ton of the wheat, but still suffering from the micronutrient deficiency. The reason is that we prefer our culture, and we more focus like on the wheat staple food. Either we have the different food groups like we have the meat and meat product, we have the milk and meat product, vegetable, but the more food group that we focus is the cereal group. Approximately a man daily take 300 gram of the wheat flour daily. If we see the nutritional composition of the wheat flour, it has some anti-nutritional factors like the phytic acid. You can see that calcium, copper, magnesium, and the zinc, they are very important micronutrients. But phytic acid will bind these micronutrients. That is also a reason we suffer from the micronutrient deficiencies due to the lack of variety in our daily diet. There should be the food diversification. We should take from food from all these food groups. As we pay attention to the wheat or the cereal group, we also need to pay the attention to all these food groups: fruit, vegetables, milk and milk products. So the one thing that we need to focus is there should be a variety in our daily diet. There should be a food diversification. And the other important factor is the weight management. When a woman enter in the pregnancy, it is our responsibility to educate her, to guide her, to maintain a weight according to healthy BMI range. Either the female is overweight or either the female is underweight. Because if a female is overweight, so she is at the risk of the gestational diabetes. She may be hypertensive, and it may cause the problems at the time of the delivery and may be the negative neonatal outcomes. So there are maybe the multiple complications. If a woman have the chronic health problem, diabetes, anemia, automatically it will affect the health of the fetus. So what type of micronutrients are important for a mother? Vitamin A, it is a very important micronutrient, and it is a fat soluble vitamin, and we can get vitamin A from the two sources: animal sources in the form of the retinoid, and from the plant sources in the form of the carotenoids, beta carotene. So, vitamin A is important according to the recommended dietary allowance. So avoid the supplementation of the vitamin A during pregnancy or the excessive amount of the vitamin A, because it can cross the placenta, and the excessive intake of the vitamin A in the pregnancy, it may cause the abortions or maybe cause some type of the congenital malformation. And what is the RD of the vitamin A? 10,000 international unit per day. And the dietary sources, beta carotene. From the different studies indicated that when we take vitamin A from the plant sources, then it is considered as the best for the pregnant woman. And there are the sources, vegetable, eggs, and the dairy products. And folic acid, it is a very, very important micronutrient. It is also known as the B9 vitamin, and it is a water soluble vitamin. And the function of the folic acid is to help in the synthesis of the DNA as well as in the cell division. And the right time of the folic acid intake is before the conception and during the first trimester of the pregnancy. But a number of the women has no knowledge about it. The woman who has a deficiency of the folic acid, she is at the risk of the neural tube defects, that are the spina bifida and the brain and encephaly. So, to avoid these birth defects, supplementation of the folic acid is very important. And for the normal female, the requirement of the folic acid is 400 microgram, and for the pregnant woman, 600 microgram per day folic acid recommended to avoid the neural tube defects, because 3,000 pregnancies each year affected from the neural tube defect due to the lack of intake or the lack of education about the importance of the folic acid. So there are some sources of the folic acid we can get from the diet, as well as the fortified food sources are also available: legumes, green leafy vegetables, citrus fruits, and the juices, bread, and cereals that contain the folic acid enriched flour. So vitamin D, it is also a very important micronutrient, and it is also a water. It is also fat soluble vitamin, because the role of vitamin D help in the metabolism of the calcium and the phosphorus. Those women who have the deficiency of the vitamin D, they are at the risk of the bone diseases. So vitamin D we can get from the endogenous sources as well as from the exogenous sources. The endogenous sources, like from the sun exposure, sunscreen in the skin, and from the exogenous sources we can get from the dietary sources like the egg. So it play important role in the homeostasis of the calcium. So if there is a deficiency of the vitamin D during pregnancy, it may cause the lower maternal weight gain, bone mineralization may be affected, and the rickets, osteomalacia, and osteoporosis may affect. Iron, it is also very important, as we discussed in the National Nutrition Survey, that a number of the women at the reproductive age and the children under the age of 5 are suffering from the iron, and during the pregnancy, the demand of the iron increases due to the hemodilution. So there are the number of iron sources available: heme sources and the non-heme sources. The heme sources that we get from the animal, and the non-heme sources that we get from the plant sources. So there are also iron fortified foods are available. The recommendation of the iron is 18 milligram per day for a normal woman, and for the pregnant woman the requirement is 27 to 30 milligram per day. But when we take the iron or recommend the iron, we should keep in mind the iron absorption enhancer or iron absorption inhibitor, because there are the number of the anti-nutritional factors in the tea, in the coffee: tannin, phytate, oxalic acid. They bind the absorption of the iron by making the insoluble complexes with the iron. So when you will take the iron or recommend the supplementation of the iron, avoid to take the iron from these food sources that contain the anti-nutritional factors. And what are the iron absorption enhancer? Vitamin C, citrus fruits, they increase the absorption of the iron. essential fatty acids. They are those fatty acids that cannot be synthesized in the body, and we can take these fatty acids from the food sources. Essential fatty acids, like we have the omega-3 fatty acids, and we have the omega-6 fatty acids. The omega-3 fatty acid further have the plant sources and the animal sources. Plant sources like alpha-linolenic acid. Flaxseed is a good sources of the alpha-linolenic acid, and the animal sources icosapentaenoic and icosahexaenoic acid, and the fish oil is a good source. And for the omega-6 fatty acid, linoleic acid, soybean, and the sesame, they are the good sources for the omega-6 fatty acid. They are important because necessary for the cell membrane, for the central nervous system, retinal membrane, cognitive brain development, and they also play a role in the motor activity in the infants. And the intake recommended for the omega-6 and the omega-3. For the omega-6, 3 gram per day for the pregnant woman, and 12 gram per day for the woman who have the age 18 to 15 years old. And for the omega-3, 1.4 gram per day and 1.1 gram for those women who have the age 80 to 50 years old. The iodine. It is also a trace element, and we can get it from the dietary sources. It is required in minute quantity, but when we see the functions of the iodine, they are very, very important. And the requirement for the iodine is 150 microgram per day, but the deficiency of the iodine may cause the abortion, stillbirth, mental retardation, and the cretinism, goiter. So you can see that iodine is important, basically play role in the growth, in the basal metabolic rate, basal metabolic rate, neurological development. But you can see in the diagram, we require normally 150 microgram per day of the iodine, but if there is a deficiency at this level, it may cause a low IQ level. At this level, low energy, cretinism, stillbirths, and the abortions. Abortion means the death of the fetus before the 20th week. But if the death of the fetus occur during the delivery, before the during the pregnancy, during the delivery, so after the 20th week of the pregnancy, then it is considered as a stillbirth, loss of a fetus. So if there is a 0 microgram intake of the iodine, there is no existence of the life. And these are the different diagrams that are indicating the deficiency of the iodine. So, being a nutritionist, being a dietitian, we should focus to the intake of these micronutrients. We should educate the mother, and we should guide the mothers as well as the families. So, there are also some roles that are played by the government to overcome these micronutrient deficiencies, like Pakistan Vision 2025 document. The one purpose that is involved in this is to overcome the malnutrition sun movement, that is known as the scaling up nutrition, multi-sector nutrition strategies, and national fortification alliance. So a number of other programs are also working to overcome the malnutrition. So we should guide the families and the female, and we should provide the guidelines and awareness to the community that the nutrition of a female is important before the pregnancy, during the pregnancy, as well as after the pregnancy, to overcome these malnutrition and the other associated complications of the malnutrition. Thank you very much.